Hello, Dr. Eric Ledzinski here, Fanwood Back Relief Center. Today we're going to discuss how arthritis can worsen whiplash outcomes. In other words, if somebody already has spondylosis, damage to the disc, the joints in the neck, and they're involved in an auto accident and sustain whiplash, how is the outcome for them versus somebody who does not have any arthritis, the prognosis for that individual? And what they find is that the more arthritis someone has, the slower the recovery, the more difficult the recovery with somebody who's in a car accident and sustains whiplash injury. Which means, generally speaking, as we get older, 65 and older, we start to see degenerative changes in the spine. Now those can be enhanced or come on earlier in life if there's multiple injuries or even a really traumatic insult to the spine. Those degenerative changes can occur much earlier in life. We see patients come in their late 20s or 30s with a significant amount of arthritis in their neck due to early trauma, injury, and not getting it addressed, not getting it fixed, not getting it properly adjusted, and they start to see these degenerative changes. And as they get older, and if they're involved in another accident, it really makes the prognosis very, very difficult. So some of the symptoms with whiplash injury are neck pain, shoulder pain, pain down into the arm and the hand, weakness in the arm and the hand, numbness and tingling can occur, difficulty with range of motion, moving your head, looking over your shoulder into your kids in the back seat, looking over to see if somebody's in the lane you're moving into. So it's very important that you have that full range of motion, and the arthritis and whiplash symptoms can limit that severely. Degenerative changes in the spine can cause other issues as well. More limited range of motion, more pressure on the nerves, more irritation over time, and it could affect as well the spinal cord itself. The blood flow, all that stuff can be compromised when the spine's riddled with arthritis. So very important, people that are in accidents, that they're getting checked, making sure that there's no restrictions in the neck, make sure there's no injury to the soft tissues of the spine. In our office, we take it very seriously. We start with an x-ray, make sure things are where they should be, that there is no early onset of arthritis, and that the injuries are handled properly so they don't become problems down the road. Because some of the research can show that these symptoms can exist and these problems can go on up to 2 years if not addressed in the right timely fashion. So it's important that the right rehab occurs, and the timeliness of it is important as well. So how soon can you get checked? How soon can you get these injuries treated? To make sure that you have the best possible outcome. And in the past, the thinking on this was, to put a cervical collar on, a soft collar. This is the wrong thinking, because what happens is those tissues need to move, to heal, to rehab properly, to not get stiffened and weakened over time. It's very important, even in the early stages of the injury, that the joints are mobilized and that the soft tissues are stretched and strengthened as quickly as possible. Obviously, permitting major pain and major trauma as well. So that's what I wanted to talk about this. If you have any questions about this, bottom line, if you're in an accident, get checked immediately, get treatment immediately, don't wait, especially if you have any type of, already have cervical degeneration, spinal degeneration to the disc or the joint. It's very important that you get the right treatment at the right time. Any questions about this, just give us a call, shoot us a message. We're always here and happy to help. Thanks for watching. Talk to you next time.